Hi everybody, thank you for joining in for this very special webinar. Thanks to this herb, we're here to talk all about emotional health, IVF, fertility, and as practitioners and anyone else listening, how you can get the best outcomes, which is obviously what we're all about. Unfortunately, I can't come to you live tonight. I'm actually on a plane to the US to launch my book, which is super exciting over there. But what I want to invite you to do is if you have any questions, please ask them here and I'll absolutely check back in over the coming days to make sure that there's nothing that's gone unanswered. I want to make sure you have all the information that you need. And I'm really, like I said, I'm really excited to be here. So I want to cover a few things. First of all, I really want to help you to understand how we can start to define the patient. I think the hardest part is that we as TCM practitioners or complementary medicine practitioners, we are either often the very first point of call or the absolute last point of call. And then when it comes to IVF, we're a support to these patients. But what we know is that we can absolutely improve their outcome and success when it comes to fertility and pregnancy. Chinese medicine knows all too well how this emotional aspect of our fertility is so important. And I will actually say to my patients, if I can get your emotional state where it needs to be and have that body belief and body wisdom, then we are more than halfway there, always. So I guess when we are talking about, I'm going to dive straight into IVF because that's what I really want to help you understand how you can improve your patient outcomes with IVF. We really do need to work out why is the patient actually using IVF to have a baby. And there's lots of reasons, and there's known reasons, and then sometimes there's unknown reasons. So I guess looking at this, we know things like endometriosis, adenomyosis can, for some, impact their fertility. Obviously, implantation and hormone balance can be a factor with these. Same with PCOS. Now, I would say PCOS is more of a it's not a stab in the dark, but if you don't understand your cycles or your patients don't understand their fertility and their fertile signs, then they can really be confused as to when is the best time to actually have sex to make a baby. I guess that's the hardest part, is timing for them. But our aim is always to get their cycles as regular as possible without complications. So whilst PCOS is said to be an issue, it's more about ovulation rather than it being the environment. Although PCOS does tend to mimic other autoimmune and inflammatory illnesses, so we need to look at all the aspects behind it. So it's not straightforward, and we know that, but I think where TCM really excels is the in-between. It can look at that space in between and really help you to define the patient, work out, physiologically how we would diagnose them. And this is why it works so well, is because you can have 17 PCOS patients and treat them all differently because it is so tailored. The same for endo, the same for adenomyosis. But I'm just looking at reasons why a patient might be a candidate for IVF. We also know that there may be issues with sperm for the male. There might be injury, so there might be structural issues, and I want to touch back on structural issues in a second. Genetics, some people now are trying to bypass certain genetic issues like BRCA or cystic fibrosis, these sorts of genetic conditions that can really impact, the long-term health of the offspring. Other issues like amenorrhea, blocked tubes. At the end of the day, Chinese medicine looks at these things as a whole lot of blood stagnation that we need to address. And in my opinion, all of these things that we've mentioned, to a degree injury as well, they're all treatable. And they're not necessarily what I would be saying that you would need IVF for. However, we do use IVF for these reasons, and we do see a lot of patients in our clinic that are using IVF. So we need to be able to support them. And I think the best thing that we can do is communicate them with them in such a way. We're not at that point necessarily there to tell them their best way. They need to work that out themselves. We're there to guide and support them. And I think this is where we can get into trouble as practitioners. We know we can help these patients, but maybe they've been trying for 3.5 years and they just want the quickest and the safest way to their baby. And so that's up to us to show them. So we very much do become a support service to them, even though we know that maybe if we had time, we could actually address these issues. And I would still say we do need to address these issues, even as a support service, but they're not coming to you at this point for natural fertility. They're coming for you to improve their outcome and their success and pregnancy. Obviously, egg quality, the environment, sperm health, there's so many factors that go into fertility. The one thing I will say is that the one time that you may really need to use IVF outside of these, and so I just want to be clear, I'm not saying that you shouldn't use IVF for those things, but I'm saying that we can generally absolutely improve the overall health of the woman in these situations to a point where they are fertile. But the one time you may not be able to do that is if there has been some type of structural damage, or like I said, in the case of genetics, where a couple want to actually bypass certain genetic traits. And they're the two times I'd say, well, there is no other way that you can go around that. And thank goodness that we have IVF for all of these reasons. I will also say unexplained infertility, I would say, with our patients, is someone just hasn't looked hard enough. There is always a reason. And I get quite upset when a patient presents with unexplained infertility because I'm like, it's just lazy medicine. And we need to really look deeper, get the right tests done, really understand what's going on. But at the core of most of these conditions really is that emotional health. And if we can change that, we can absolutely improve the outcomes. So this is, like I said, where TCM really does excel, is that we have been doing this for a really long time, and it becomes quite an important part of a patient's IVF process to be able to support them through each and every stage of that. And that is a very stressful process. Whenever we've had to guide, and I'm sure you're no stranger to it anymore, guide patients through IVF, there is something that they need every single step of the way. But what you can be for them is that voice that is positive, that is supportive, and they don't really need any more stress in their life at this point. So we really do need to be mindful around the languaging and that we are using. They don't want to hear that they don't need IVF, potentially, at this point. Maybe they do, but you need to really counsel and work out who you're talking to. How long have they been on this path? What are the actual known challenges? Of course, you can absolutely support their lifestyle, their nutrition, manage stress, and that's the biggest one. But I think we need to show our patients why this is so important. They don't necessarily know, and we need to absolutely be doing it in a way that is non-judgmental. They are not there to be judged, and they're not there to be preached at. They're there just to gently basically have their hand held. And one of the things that our patients will always say to us when they come into the clinic is, I just love being here. It's the only place that I feel like I'm actually doing something for me that's positive to help to support the pregnancy. Everything else feels like I'm just a number and I'm just a process. And so whilst they need to do that and they need to be part of that system, they need your support, they need your help, and they need your positive encouragement. So we want to be using positive language, we want to be in communication with them, we want to be able to show them what we can do and communicate also in a way that we're explaining to them what's happening in Chinese medicine and physiologically from a physiological Western perspective or a scientific perspective, and marry the two together. They don't want to hear about how their heart supports ovulation. You will absolutely lose your patient at that point in time, because that's not what we know physiologically happens from the West, and that's more than likely where their brain is trained. So it's up to us to explain in Chinese medicine terms what we're doing and then translate that over so that they can start to understand exactly what is going on for them, because Chinese medicine sometimes for them is scary, and they will probably be told by their IVF doctor not to use anything as part of their IVF journey besides acupuncture. Now, I will say something to that. It is not their specialist job to understand herbal medicine. It is our job as practitioners to understand herbal medicine. So when patients say that to me, I always actually take the patient through their first round of IVF without anything but acupuncture. Now, you don't have to do that, and you need to actually work out what the patient actually needs and what the best is going to be for the patient. But I will very often not use any other herbal medicine, because if anything happens to go wrong, it's not going to be modern medicine's fault, it's probably going to be yours. So that's one little tip I'll give you, that I very often say, all right, this first round, we don't know how you're going to respond, but we're going to assume that you're going to respond well. But we don't know, so let's be positive. So we're going to sit this one out when it comes to the herbal support, but we can bring it in should you need another round of IVF. And I think that's the safest thing that we can be doing. The other thing I'll also say to that is, like I said, very often their doctor will say, oh, I don't know what's in those herbs, so I don't want you to take them, which is understandable, because if you had a patient that came to you and you didn't understand what their medicine was, well, you'd probably do some research. But the reality is that TCM is so complex and intricate that I don't think if a specialist was to go every single time and research a formula, they'd probably never get any other work done. That's why we studied for a really long time to understand that. So I will always say to the patient, that's okay. That's not their job. That's my job. So you just leave that with me. You don't need to worry about that. I would never, ever give you something that is going to be counterproductive or dangerous when it comes to your health, especially not when you're using other drugs, especially those that are part of an IVF protocol. So really reassure your patient that you know your stuff, because if you're using certain patents, especially something like Sunny Pills, we know the ingredients, we know the interactions, and we know that it's really safe. And I think that can be really lovely also for younger or newer practitioners, for you to know that, because it can be really scary. And how do you answer that question? It's such a complex and intricate intertwining between how, or the synergies of herbs alone, let alone the interactions with other medications. So we need to show our patients, like I said, why all of this matters, and really counsel them through and be able to support them, to show them that this is safe, that this is effective, and we're here to help. And I think if you can do that in a way that's also takes their concerns and needs on board, and we should always be listening to our patients' concerns and needs and explaining to them every step of the way what we're doing. Now, from a TCM viewpoint, I just want to touch on some of the emotions, especially when it comes to the Sunny Pills and what we're actually doing and why they work so well to support the emotional health through the patient, whether it's natural fertility or IVF, but we're here talking about IVF. So I want to remind you and do a quick 101 on the role of the heart and ovulation. Now, if you're watching this with a Western brain, that was me once upon a time. I studied science as well, and I used to be like, I don't even understand what this is talking about. But remembering that TCM diagnosis is at least 3,000 years old, very different form, and I will also translate this into a Western mindset as well. So we know the role of the heart in ovulation. The heart actually communicates with the uterus for ovulation to happen. Now, if the heart energy is stagnant, so if you have stagnant heart chi, then this can actually impact ovulation. It might impact the time of ovulation, it might impact the quality of ovulation, or ovulation might just not happen at all. If you've got a lot of stagnation, that message from the heart to the uterus is just not going to happen. So we know that things like prolonged stress can absolutely influence that communication, and we know that this obviously then disturbs ovulation, so this becomes a factor. And we really, obviously, ovulation's the star of the show. Now, we're talking about natural fertility, I know, but I just want you to have the 101 as to why it's so important to support the emotions. We know that via, like I said, the bowel channel, there's that communication that happens, and we can see other symptoms when we have stagnant heart chi that include issues with sleep, depression, anxiety, palpitations, dreaming, restlessness. These are all some of the symptoms that we can see commonly. But we just need to understand that the role between the heart and also the kidney, obviously, really is part of healthy ovulation. And I very often in these patients will feel that their front and rear pulses are quite weak, especially the front on the left and the rear on the right. And if you can see that disconnect between the heart and the kidneys, then it's almost like, I know ovulation is not going to happen until we actually reconnect those two again. The heart and the kidneys provide that perfect balance of yin and yang. And so when this isn't there, this becomes obviously an issue. And again, it's that balance of water and fire. So really being able to have a that connection there is very, very important for fertility and very, very important for ovulation. We also know that I said this before, sorry, the heart influences, I get ahead of myself with my notes, the uterus via the bowel, and it travels to control the opening of the uterus. So the heart energy actually is there to open the uterus and allow ovulation to happen. Now, of course, again, if the heart chi is stagnant, look at me and my little light coming through. If the heart chi is stagnant, then this is not going to happen adequately. It could just be, I always say that we want the quality of ovulation to be like gangbuster. And these patients, if you're having them chart their fertility or at least track their fertile signs, these are the patients that take a really long time to ovulate. They may try and ovulate, and then the body doesn't actually follow through, and they come back and they try again several days later. And you can have multiple attempts of ovulation. It's always the last time that someone tries that ovulation actually happens. So these patients, you'll generally see that they will take a long time to ovulate. They'll have these fertile signs over 3, 4, 5 days. I want patients to have fertile signs 1, 2 maximum days to really know it's been a quality ovulation. If you want to look at this from a Western perspective, obviously it's that communication from the hypothalamus and pituitary triggering ovulation to happen. So you could almost liken in Chinese medicine the activity of the heart to that of the hypothalamus and the pituitary that instigate that, and obviously that help to like I said, instigate healthy ovulation and to get that to happen. We can also see this when we have amenorrhea, or especially hypothalamic amenorrhea, where this communication just isn't happening. So if you have a patient with hypothalamic amenorrhea, starting to work on the heart energy might be the missing factor if you haven't done that yet. But generally you can also feel that in their pulse. They have that weak top pulse, which is either really deficient or really weak. And if then, of course, the qualities that also come with any type of stagnation, when you can feel that in the pulse. You also want to see the tongue and what the tongue looks like, and usually you can see that on the tip of the tongue in that area that corresponds to the heart. Most issues when it comes to the heart are actually emotion related. So, really counsel the patient and have a look at what's happened throughout their history of their life. And you need to be really mindful and careful with this. And maybe they're the patient that hopefully you've got to see them before they've started their IVF journey, and you really need to calm Shen, and you really need to support the heart energy before you are going to start to have conversations with them about actually, the emotion of the heart is overjoy, but when we're sad, it can be, a factor too, the heart and the lungs, and really explain to them the roles of the emotions in the organs. And then just say, I don't know if this is relevant to you, but I've been treating your heart energy a lot. And just sort of enroll them in the idea. I plant the seed. I say to them, you don't necessarily have to have a conversation with me about this. I just want you to understand and really earn their trust, because if they've had some type of trauma, especially abusive trauma, they might not want to open up straight away to you about that. But if you can earn their trust eventually, that's going to be really important. And it's going to be really important in factoring getting positive outcomes when it comes to their fertility. The other thing I want to talk about, and this is because Sunny Pills really takes into consideration both heart chi and liver chi, and there's obviously other organs that are involved in fertility, but these are the main two that we're talking about, and these are the main two that are really going to improve your outcomes in IVF. Prolonged emotions are going to also lead to liver chi stagnation. So prolonged frustration, prolonged anger, and of course the pill and other medications can really stagnate the liver chi energy. We know this from a Western perspective. We know that liver detoxification is a factor when a patient comes off the pill. We want to make sure that we're looking at that liver detoxification, especially that phase 2 liver detoxification. So that second pathway. So we really want to make sure that the liver is behaving. And if the liver qi is stagnant, that can affect the digestive system, that can obviously affect other hormones as well. And so just make sure you're looking for those other symptoms. Obviously, anger and frustration, or prolonged anger and frustration, PMS, that stuffiness in the chest, pain in the flanks. We learned all of this back in the day. I don't see a lot of patients that have flank pain, but we used to talk about it all the time when we were learning. Other things like breast tenderness, especially in that window from in that luteal phase. But we can also see disturbance of ovulation as well when the liver energy isn't doing what it's supposed to. So it's really, really important that we start to look at all of these factors when it comes to supporting fertility, because these are going to give you the outcomes that you need when it comes to the success in your IVF outcomes like we keep talking about. One of the biggest things, I just want to touch on a few other things, and I know we're running short of time. To communicate with the patient, one of the biggest mistakes I see is that people give you the worst case scenario. And whilst there's the glass half empty and the glass half full, when it comes to actually improving your health, I think you need to give people best case, not worst case, unless you're dealing with something that's really serious. Now, you're not the IVF doctor, and I'm not saying IVF is really serious. So that's not really your role. You're going to show them all the reasons why you can improve their health, all the things positively that you can do. And I think that becomes important, because you really do become one of their biggest hopes. And you can offer truthful information positively, and I'd really encourage you to do that. So I've said to you, integrating TCM and Western medicine can be tricky, and I touched on that before, where your IVF or your doctor might say, oh, that's not a good idea. You're there to show them all the reasons why. Sometimes I might even write their doctor a letter and say, this is what we're doing, and I know that this is safe, and it's been very well researched and very well documented, and really just reassure them that we've got, when it comes to the Sunny pills, we've got case studies that really do demonstrate the really positive outcomes of patients who have had 2 or 3 rounds of IVF unsuccessfully, brought in the use of something like Sunny pills, and it's in absolutely taken them through a positive IVF experience, positive pregnancy, and a baby at the end. So we know that this really works. Like I said, it's not really their expertise, and it really is up to us to be able to support the patient as much as we can, to show them all the reasons why it's positive, and we're not doing we never do anything that causes any harm. So we know that Sunny pills absolutely increase the success rates in pregnancy. Like I said, we have lots of case studies that absolutely display that, but where we know it really excels is with these patients and the emotions. And if we don't get this emotional element right, it's not that you're not going to ever fall pregnant, but it's going to take a lot longer for these patients. So we want to make sure that we're being very safe, very efficient, and effective. And like I said, very often by the time a patient is in the hands of IVF, they've already been on a long journey, and they just want to get there as quickly as possible. So the reason that Sunny pills does this is because it obviously it boosts liver qi and heart qi, which we've been speaking about. And heart and liver function, and they're really, really important. We know also Sunny pills tonify qi and blood and optimize fertility, both hormones and the environment. So we need to remember that we're dealing with hormones, we're dealing with egg quality, we're dealing with the environment, the endometrial lining, the state of the uterus, and then the overall body. We understand that the reproductive organs don't work alone. They're not lone riders. So, to look at some of the herbs that are in Sunny pills, I think there's lots in there. And again, looking at the intricacy of this formula, it's such a beautiful, well-rounded, researched formula that we know is really safe to use for fertility and emotional health. But I'll go through some of them. So some of these herbs are traditionally known to strengthen blood, to support the adrenals, or to support the kidneys, I'd say, in Chinese medicine very much when it comes to that. Oop, hope that didn't freeze just then. And really strengthen the heart or move the heart and the liver energy, or the liver qi, and strengthen both of those. So we've got herbs like guizhi. We know a lot of these herbs go to the heart. Guizhi is beautiful to warm and invigorate, and it's that offering that yang support. So obviously boosting circulation, boosting your mood. Ganjiang is another one of my favorite in there, a very powerful antioxidant. It's also going to support the yang, but also not just the heart energy, but also the gut, which is also really, spleen and stomach, the spleen-stomach axis. Wuetzi is another really amazing herb. It's said to open the uterus and really tonify the kidneys and the essence and really support fertility. It also calms Shen. It helps with moving the heart chi and also boosts the liver and supports your adrenals. So just those three alone are doing a wonderful job. We've also got other ingredients like Swanzhao Ren, again, very calming, goes to the heart and the liver, helps to really nourish the heart and regulate liver. It's also anti-anxiety and it's slightly sedative. Mamandong tonifies yin and clears the heat, and therefore starts to work on irritability. Another very nice favorite is Shudi, obviously blood tonifying and slightly moving and invigorating. And again, it also works on the essence as well, which I think is really important when we're supporting kidneys to support our overall hormones. Dangshen, again, there to support and nourish qi. Shaowu to tonify blood. Mudan Pi, Jutzi, both help to clear heat but are invigorating and gently. We've got other herbs in there, like I'll just read another few out. Xuan Fu Hua, Danju Ye. For anyone that's watching that I'm massacring these pinyin names, just forgive me. What else do I love in there? I said Danju Ye. Great, again, because it goes to the heart and helps to calm and reduce irritability. And some of these others to break up stagnation and really move and unblock the channels, like Shanyao, Gualo, Juru. But really, there's so many that I probably actually haven't done justice. But we know as TCM doctors that it's not just that single action of the herb, it's actually how they all come together and synergetically work to get completely amazing outcomes. And so really, when you put them all together, and they have been beautifully crafted and selected, they are there to target the flow of qi of the heart and the liver at the end of the day to improve your overall well-being, but really work on that emotional aspect that's so important for overall fertility and fertility support. So like I said, we're benefiting the body, we're benefiting our hormones, we're regulating qi and blood, we're looking after the overall environment to increase egg quality, to increase hormone quality, to help us to be calm and approach our fertility in a way that is positive. And then of course we want to look after the actual uterus itself and really that increasing blood flow to the uterus, something like Wuetzi to really target that area. And I say to patients all the time, you really want to have beautiful blood flow, nutrient qi flow to the uterus at that time. So that you can help to support healthy implantation as well. So we're not just interested about eggs, and we're not just interested about implantation. We're interested in the whole piece and pregnancy as well. And so you can safely know that when you are able to integrate something like Sunny Pills into your IVF protocol that has this safety and this research behind it, then you can really feel comfortable in the fact that you've got this amazing tool that is patented, that the patients will be able to take as well. So that's one other thing I want to touch on. Patient compliance is really great. And whilst raw herbs have been traditionally used, in my experience, people just don't take them. And if they do, they'll take them for a little while and then they'll just stop because it's just... we live truly in a fast-paced world, and that's half the reason why we're finding our fertility rates are where they're at. So what I love about this is they're obviously easy to administer because they're a pill, and patients can take them anywhere at any time. It doesn't rely on them having a kitchen where they have to brew up herbs, and then also how palatable those herbs are. I know personally as a practitioner, I really struggle to take them. So how can I expect my patients to be able to take them if I can't? So I hope that gives you some more information that you can add to your toolkit when it comes to treating fertility, and especially supporting IVF and regulating the emotions. Of course, we can use Sunny Pills for emotional health outside of IVF and outside of fertility, but I really wanted to show you and give you some information as to why these would be really useful and be really useful in your dispensary to be able to support your patient and support IVF and fertility and pregnancy for the long term, not just the short term. So please, like I said, if you do have any questions, please ask them in the comments section here, and I will check back in once I'm on the ground and I can answer some of these questions for you. It's been an absolute pleasure to chat with you today, and really excited to see tools like Sunny Pills in your dispensary where you can really take your patient's health to another level. Bye.